Hey, what's up everyone, and welcome to my channel. Today, we're getting right to the point of a therapy that has totally blown up in the world of sports and fitness, dry needling. I'm curious, have you heard of it? Maybe you've even tried it yourself. Let me know down in the comments. We're gonna break down what it is, if it actually works, and what the real risks are. If you're ready, make sure you hit that like button and let's get into it.
So if you follow any pro sports or you're just kind of into the fitness scene, you've probably seen athletes getting this treatment done. Dry needling is a huge go-to for physical therapists and sports medicine docs who are trying to treat muscle pain, tightness, and, speed up recovery. It's really seen as this key tool for keeping athletes at the absolute top of their game.
But behind all that popularity, a really serious question has come up. Can a therapy that's supposed to relieve pain actually cause some major harm? Well, the answer is a lot more complicated than you might think, and it all revolves around a story that sent a huge shockwave through the NFL.
And that brings us right to our first section, a shocking sports injury. We're going to look at a real-life incident that forced a really tough conversation about the safety of a therapy that, honestly, most people thought was pretty much harmless.
I mean, it sounds almost unbelievable, right? You go in to treat a sore muscle, and you walk out with a potentially life-threatening injury. How in the world is that even possible? To really get it, we need to look at what happened to one of the biggest stars in pro football.
So, back in late 2022, Pittsburgh Steelers superstar T.J. Watt was suddenly sidelined with a partially collapsed lung. And the reports that started coming out said the injury wasn't from a massive hit on the field, but was actually linked to a dry needling treatment he had just gotten. All of a sudden, this really common therapy was all over the news for a super alarming reason.
The medical term for this whole thing is a pneumothorax. So basically what happens is air leaks into the space between your lung and your chest wall. This little pocket of air then pushes on the outside of the lung, causing it to deflate, kind of like a balloon with a hole in it. It's a serious medical situation that needs attention, like, right away. Okay, so to understand how a collapsed lung can even be a possibility here, we first need to get a really clear picture of what dry needling actually is. Like, what is physically happening when that needle goes into the muscle? Let's break it down.
So at its core, dry needling is a technique that comes from modern Western medicine. A trained practitioner, usually a physical therapist, takes a super thin, solid needle and inserts it into a very specific spot in your muscle. And the key thing is that nothing is injected. That's why it's called dry needling. The whole goal is to hit something called a myofascial trigger point.
So what in the world is a myofascial trigger point? Honestly, the easiest way to think about it is that it's a tiny, super irritable knot in a tight band of muscle. You know that one sore spot that when you push on it, it doesn't just hurt right there, but it can actually send pain to other places? That's it. It's like a tiny, super stubborn muscle cramp that just refuses to chill out.
The process itself is pretty straightforward. First, the practitioner feels around to find that tight little knot. Then, they insert the sterile needle right into it. The main goal here is to get what's called a local twitch response, which is just an involuntary little jump or contraction from the muscle. That twitch tells them they've hit the right spot, and it's believed that this twitch helps the muscle fibers finally release, reset, and relax, which is what reduces the pain and helps you move better.
All right, now if you're sitting there thinking, wait a minute, thin needles, pain relief, isn't that just acupuncture? You have just hit on the biggest point of confusion and, honestly, controversy around this entire treatment, because while they look kind of similar, they come from two totally different worlds.
Okay, here are the main differences. Dry needling is way newer. It came about in the 1980s, and it's based on our modern understanding of Western anatomy. It targets those specific trigger points to relieve muscle pain. Acupuncture, on the other hand, is ancient. It's a huge part of traditional Chinese medicine, and it works with points along what are called meridian lines to balance the body's energy flow, or qi. And it's used to treat a massive range of conditions, not just muscle pain.
But here is where it gets really interesting. One of the founders of trigger point therapy, a doctor named Janet Travel, actually noted that a whopping 92% of trigger points line up directly with known acupuncture points for pain relief. 92%. This incredible overlap is exactly why the debate gets so heated. Are they really two different things or just two different ways of describing the same thing?
So we know it's popular, and we know how it's supposed to work, but that brings us to the most important question of all, right? Does the science actually back it up? Does it really work?
Well, the research is a little mixed. When scientists do these big reviews of lots of different studies, they found that, dry needling can be pretty effective for short-term pain relief and helping you move better.
but the evidence for any long-term benefits is way weaker. Pretty much all the researchers agree that we just need more high-quality studies to know for sure.
And this brings us all the way back to the T.J. Watt story and that big question of safety. Now that we understand the procedure and the evidence, let's take a clear-eyed look at the actual risks involved, from the super common ones to the extremely rare.
Okay, so the good news is that most of the side effects are really mild and they go away pretty fast. The most common things you might see are some minor bruising or maybe a tiny drop of blood where the needle went in. It's also really common to feel a bit sore for a day or two, kind of like how you feel after a really tough workout. Now, a slightly more significant but less common reaction is something called a vasovagal response. This is that lightheaded, dizzy, maybe even faint feeling that some people get around needles. It only affects a pretty small percentage of patients, and it usually passes within like 20 or 30 minutes with no long-term issues.
Just to put all these risks into perspective for you, look at this. The common minor side effects, like soreness and bruising, that's by far the biggest bar. Then you have the less common reactions, like fainting, a much, much smaller bar. And those rare, serious complications we're about to talk about, they're that tiny little sliver at the end.
So while they are very rare, serious complications can happen. These include things like bacterial infections if sterile needles and practices aren't used, nerve damage if a needle is put in the wrong place, and, as we know, a pneumothorax if a needle accidentally punctures the chest cavity. So, just how rare is a collapsed lung from dry needling? Well, according to one huge study, a pneumothorax happens in about 1 out of every 1 million treatments. 1 in a million. So while the T.J. Watt story was absolutely shocking, it is so important to understand that it is an extremely, extremely rare event.
Which brings us to our final and most practical section, your guide to needling. After hearing all this, how can you make a smart, informed decision for yourself? We've put together a simple guide to help you navigate this whole thing safely.
Okay, so let's say you've got this nagging muscle pain and your physical therapist suggests dry needling. What do you do? What do you need to know, and what should you be asking to make sure you're in good hands?
Being informed is everything. Before you agree to anything, you should feel totally empowered to ask these questions. Ask them straight up. What is your specific training in dry needling? Talk about the unique risks for the body part they want to treat, because needling your glute is way different than needling a muscle near your ribs. Always, always ask what the alternatives are. And finally, a great provider will have a clear plan for what to do if you have a bad reaction. Their answers will tell you everything you need to know.
So, what's the final verdict on dry needling? A modern cure or just a rebranded tradition? The truth is, it's probably somewhere in the middle. It's a tool that really seems to help a lot of people with short-term pain, but it's not without its risks, and the skill of the person holding the needle is absolutely critical. Ultimately, understanding both the potential benefits and the pitfalls is the real point. So what do you think? Have you had an experience with dry needling, good or bad? Share your story in the comments below. Thanks for watching my channel, and we'll see you in the next one.